main components. One is the heel support. The second component is this plate above the talus that aids in it. We nicknamed it the tailor tuck. And the third and most important component is the black rubber bungee that provides internal pressure to push the tailor tuck onto the talus to promote ankle dorsiflexion. And here you can see what the entire contraption would look like on your feet. So, as she explained, what is dorsiflexion? Dorsiflexion is the simple ability to pull your toes towards your body or towards the sky.
So what are the experts saying about ankle dorsiflexion? Andrew Cage, the head athletic trainer at UT Tyler, says this: the difference between injury and good biomechanics is only 1 centimeter in ankle dorsiflexion. Also, Dr. Aaron Horschig says this: our ankle is a fairly stable joint. However, it is prone to becoming stiff and immobile.
We need a certain amount of dorsiflexion. If not, we have to compensate. This was stated by Eric Cressy. So, how do we come up with this product? This x-ray that you see on the left is my ankle. And if you look closely, right here, if you zoom in, I have an impingement, an extra bone growth. It's just called a bone spur. And this has occurred from having wrong movement patterns and having these bones, the talus and the tibia, collide over time, causing ossification and creating this situation that I have. My ankle dorsiflexion is further limited now by the production of these extra bone growths. So, how do we solve this problem? What I have to do is to get a surgical procedure that will cost at least $20,000 to $30,000, depending on which country you get that surgery in. So, what we're focusing on is preventing a situation like this from happening to begin with.
So ankle dorsiflexion is also very important in sport performance. As you can see in the picture up here, we have Usain Bolt, and ankle dorsiflexion is extremely important in sprinting, any kind of movement like that. If you have improper ankle dorsiflexion, you're not going to be able to perform at your peak performance. Also, in more stagnant sports such as weightlifting, to perform proper technique, you need to have proper ankle dorsiflexion as well.
So, how is the device that we're proposing unique? Now, people who get issues with ankle dorsiflexion usually are your average person that has rolled their ankle, or people that have injured their ankle from playing sports, or maybe just walking, taking a wrong step on the curb. So, most treatment devices that you put on your ankle work by limiting your range of motion, right? And this can further stiffen your ankles and reduce your ankle dorsiflexion and cause problems further down the line that you might not recognize initially. So our goal is to enable you to move. And the health industry is moving towards more of a holistic approach rather than a quick approach, which we've seen in the past.
So there are a couple current methods for treating lack of ankle dorsiflexion, but there are 3 main issues with them. First, they're expensive. Second, they're time consuming. And third, they're stagnant. So the picture at the bottom here, we have someone going to visit a chiropractor to perform this ankle mobility technique. It's very expensive to have to go see a chiropractor for something like this. And also, in the picture up here, we have someone performing this stretching exercise before their workout. This is kind of time consuming to have to perform this before every workout. And it's also a very stagnant exercise, so it's not going to be as applicable to the things you're going to be doing during your actual workout.
So, how are we different and how are we better? Well, the first thing that you see is we're inexpensive. You don't have to see your chiropractor 7 times a week after an ankle injury or if you want to improve your sports performance. You can just have a one-time cost of buying one of our devices. It's fast, it's as quick as putting on a shoe, and it works quickly. And it's agile. So this means you don't have to be stuck in a doctor's office. You don't have to create an elaborate contraption to improve your ankle mobility by yourself. And this means that you can wear this device during your warm-up, while you run, while you squat, during your exercise, at home or in the office. And the best part about our product is we attack the cause, not the effect that you'll see.
So talk to me about numbers. What's your projected cost on this? What's your projected revenue?
Okay, so we're looking at costing about $5 per unit to create. And we're looking to sell it from around $25 to $30.
So we want to produce quality at first instead of quantity, and we want to be in the medium range when it comes to the sports version of this. Now, for the medical application of this, the profit margin could be a lot higher. We could sell it to people that have insurance for a lot more, and we could bargain our price with more power in that industry.
How many people would need this product? You said the industry was 8 billion, but wasn't that the sports medicine?
Yes, that
How
was
big
just-
is the industry for you?
Okay, so ankle issues are one of the most common issues you see in sports.
So
nowadays.
the rolled ankle makes up about 44% of injuries that people go to the doctor for. So we don't have an exact number of what the market for that is, but 44% of people that go see an orthodontist and orthopedics is because of an ankle issue. And foot issues are also included to that in addition, but we don't have the exact numbers.
Okay, and is it always the same ankle issue that you guys can fix?
So one of the big misconceptions is that things don't work as a part in the body. So by targeting ankle dorsiflexion, we're able to actually improve other things like flat feet by promoting proper biomechanics, which other braces cannot do. You know, we can heal ankle pain, knee pain, hip pain that are caused by lack of dorsiflexion. So the big thing here is that dorsiflexion is an underrated problem, and more people are recognizing that this is a big issue that causes other things as well.
Is this a one-time, they buy it one time and that's it, or does this thing ever break or replacement?
So I'm sure the purpose of this is to buy it one time and use it for a long time. If that makes sense. So you probably shouldn't need one for a second injury. You can keep one. It's a one-size-fits-most approach. That's what we're having.
It's probably something that you would keep like the same period of time for like an ankle brace. Maybe you wear it for a season or two, and you might have to buy a new one after that.
So in your video, I think you show that you're testing something out, right?
Mm-hmm.
Okay, so I would imagine it would shift when you're running the cup. Is it pliable? Is it stiff?
Yeah. So what you see here is our initial version of the prototype. It's just a proof of concept. So what we're actually trying to do is use nylon fabric to create a more sturdy and something more flexible and something that can hold on to you a little better. So this was just the proof of concept.
What sort of, I don't know to say the right words, testing, sort of market results or actual physical results that you're going to have to track to convince an orthopede to recommend this product, even though it's inexpensive and can be self-administered, sounds to me like, to get an orthopede to recommend and say this is a good device for your kid, that's a big step. Tell me how you're going to get there.
Yeah, so one of our huge things in that is our 2D motion capture live at UT Tyler. We're working with the Hunis department and doing things like that. So we're trying to further validate our idea by having people use it and then seeing how it changes in their gait cycle, which is just how they walk every day.
So in addition to that, I would say the people that we need to convince the most are the athletes to use it, because someone who's a medical professional, especially in orthopedics, would know
1 minute.
they're taught that this issue is fixable. And like we said, they are trying to fix it, but all the approaches are manual, done by hand or in a stagnant way. This is the same result, just portable.
Have you reached out to orthopedics?
Yes, I have proposed this idea to a lot of them, and they all said, yeah, it's a good idea, I should move forward with it, and that's the reason why we're here.
How much is the clinical trials?
So initially, since we're students, it's just work we're doing in the lab. It's not costing us anything. But further down the road, we don't have any exact numbers as to how much the official study would cost.
I think one of the judges would know exactly how much a clinical trial would cost us.
It's very expensive, but one of the things that I want to commend you guys on, rolled ankle is definitely a big item, but you're also doing the hip joint and the knee
Time.
with that. combination. The clinical trials, depending on if you go medical, is gonna be a whole lot different animal than if you just go into athletics in a local area. So you have to be very careful on what you're doing, but you've got to have some kind of research like you had on the board up there to see, okay, here's the progress of what's going on. Once you have that, then the thing will take off.
We fully understand. Thank you.